Oh hi, welcome back. Today I have a very curious case of trauma to the chest. It is a middle-aged man who was stabbed twice to the chest in a bar fight and survived. He got to the ER room all covered in blood and saying, "I just got stabbed." And the doctors quickly ordered a CT scan of the chest, and we are going to see what really happened to this man. So let's get to the images of the CT scan. So this is a CT scan, a cross-sectional image of the chest of this male patient. And if it's your first time here, let's just do a quick recap. A CT scan, a computed tomography scan, is a axial image modality. So the patient is laying down on the table, on the scanner table. His face is facing the ceiling, his chest is facing the ceiling, and he goes head first into the scanner. And you have to picture yourself as if you were sitting by the sole of his feet looking forward. So just to be clearer, this is his left side, this is his right side, this is front, and this is back. So left, right, anterior, posterior. This is the table and this is the patient. So let's go check the scanner. Let's see how can someone be stabbed twice on the chest and still survive. So we have to read a CT scan of the chest in 3 window configurations. We have to look for soft tissue lesions. We have to look for lung parenchyma lesions and bone lesions. We have to read the scan in at least 3 windows to be able to see such lesions. So let me set this up. This is a soft tissue window. I can make it a little bit darker so we can see more of the contrasting tissues. And this is a very contrasting window, very narrow window that is better tailored to look for parenchymal lesions. In this case, we know the patient is alive, so he may be facing some kind of flesh wound and not a major visceral lesion. So let's roll and look for a kind of laceration to soft tissue. I talked to the doctor. He said the lesions were on the left side of the chest. So this is the left side. Let's see if we can see some kind of laceration. So right here, as you can see, we have a lesion to the soft tissues, the anterior soft tissues of the left side of his chest. This is a skin and subcutaneous laceration. Let's keep going down. And the laceration continues. And this is also a laceration. There is a trajectory. It has reached the pectoral muscle, the major pectoral muscle right here. And it still goes inward toward the sternum. This is a lesion, the same stab wound, and it has reached the mediastinum and the abdominal cavity, pretty close to the pericardium right here and right here. So we have a tiny lesion close to the heart and a tiny lesion close to the left lobe of the liver, the hepatic left lobe. So let's do a multiplanar reconstruction. I bet the coronal view may, right there. This is what I'm talking about. Just let me put this on a single view. So This is exactly what I was talking about. Oh no, I know I'm used to the Excel view, so I guess most of you aren't, because you are not used to reading scans every single day. So this is the stab wound, one of the two stab wounds. So this is the stab wound, this is the trajectory, this is the laceration, and this is the trajectory of the knife blade towards the heart and the liver. So we have the left lobe of the liver right here and the heart just above it. So this man was extremely lucky when he suffered this stab, because the laceration was deep, it was oblique and deep, and it went from the left side of his chest downwards and inwards, but it didn't hit anything else than soft tissue, muscle, skin, and subcutaneous tissue. There is maybe some cartilage lesion, chondral lesion right here, and it stopped at the preperitoneal fat tissue, just a few millimeters from the liver, just less than 1 centimeter, less than 10 millimeters from the left lobe of the liver, and pretty close to the pericardium and the heart. So he was really lucky when he got stabbed like this. Let's see if the sagittal view gives us a few more details of this specific wound. So you guys have noticed that a soft tissue laceration has a discontinuity, a cut of the tissues. It has densification of otherwise pretty dark gray areas, which means blood or edema. And it also has these little areas of hypoattenuating things, are air. It's emphysema. It's air inside soft tissue that comes from the passage of the blade through the tissues towards the inside of the cavities. So this was a very lucky strike, and right here you can see that he was also struck by the same blade on his left shoulder, right here, his shoulder, right here. There is densification of the soft tissues, emphysema, air on soft tissues, and a laceration that goes deep into the shoulder muscles and the pectoral muscles, like this, in this direction. So we know there are a bunch of axillary and subclavian vessels that can be hit and can be very serious to treat and can be deadly if hit by a sharp blade. So the blade got into the soft tissue and it reached the axillary region. There is some blood and densification of the axillary region, but it seems no major hematoma, no major collection of blood. So he also got very lucky indeed. The guy who stabbed him missed major vessels and internal organs. So we can see right here densification, right here densification of tissues on the axillary fossa, and a trajectory, a deep trajectory of the stab wound in this direction right here, from the shoulder to the axillary region. So let's hit once again the MPR, the multiplanar reconstruction, in order to see the stab wound in its entirety. So this is it. This is the stab wound right here. He was stabbed on the shoulder and the blade got to his axillary region right there. So let's see how deep the cut got, how deep the tip of the blade. The tip of the blade reached this region right here, pretty close, really close to the axillary and subclavian vessels. There is some blood, some emphysema, some air right there, really close to the vessels. The vessels are right here, and if I roll just a little bit to the front, I can see the blade was right here. Let's just measure how lucky this guy was. So, oh my God, this is so close. I can't believe he survived this one. This was like, come on. This was really close to be deadly. Really less than a centimeter, less than 10 millimeters to hit the left subclavian vein and artery. So this is the vein, and this is right here. This right here is the left axillary artery, and this is the approximate trajectory of the stab wound. So it was absolutely close. He almost took a stab to a major arterial vessel. So he survived. He had 2 major lesions to soft tissue only, and he missed major internal organs and vessels. So a little blood to soft tissue right here, and that laceration to the other soft tissue. So this is the lung window to see the lungs. There's some atelectasis, some milled ground glass opacities. This could be due to being laying down on the stretcher for far too long, or because he was hit many times by blunt force or any other cause or trauma to his back, which caused mild pulmonary contusions. But this is just mild. This is really nothing much. And as he is majorly injured to his left side, when he breathes in, he can't really expand the left lung as much as the right lung. So he gets this kind of alterations, this kind of image patterns to his left lung. So this kind of atelectasis is pretty common. It's not significant to the diagnosis itself. So the soft tissue window here on my left is pretty normal. We don't see blood on the pleural space nor on the mediastinum, which confirms that the stab wound has completely missed major organs. So there is no free fluid on the superior part of the abdomen, so it really did miss the liver. So let's see the bone window. I like to hit MPR once again and see the bone window at least on 2 views, the sagittal view and the axial view. So let's make it axial and see if there is broken bone. I can't really see, and broken ribs. No broken ribs. No broken ribs. The sternum looks okay. The ribs, the rib cage, it's okay, just some degenerative disease to the bones. So if you enjoyed this video, I'm pretty sure you're gonna enjoy this next one right here. Thank you so much for watching. Like, subscribe, and share this video with people you know enjoys diagnostic radiology. Thank you so much for watching, and see you next time.